Hello guys, this is Dentistry Booklet 2018. The first question asking about a patient that came to the doctor. They have weakness, pain in the intestines, indigestion. But here we see that they found in his intestine a microbe with four nuclei. So four nuclei microbe, this is a parasite called Entamoeba histolytica. Okay, has four nuclei in its structure. Balantidium coli will have cilia, okay, cilia like this, hair structures around it. Entamoeba coli, don't confuse it with histolytica, it will have 8 nuclei, 8 ones, 8 nuclei. Gardia will have a symmetrical structure with 2 nuclei and 4 flagella. If we have another question like it, we will see them. Next question will be about a patient diagnosed with a hereditary disease. Okay, so a disease that is inherited by genes. So all of these diseases are acquired, either virus or either hypertension throughout life. So hemophilia, only this is a hereditary disease, X-linked recessive disease. Next question, we have chromosomes number. According to the chromosomes number, most animal species have definite and constant chromosome number. The mechanism that maintains the constancy during sexual production. So here they are asking about what is the division of cells during sexual reproduction. So sexual division, okay, is called meiosis. Meiosis. And yes, in meiosis they speak about the concept that the number of chromosomes will be preserved. So if we have here 2 chromosomes, in meiosis it will stay as 2 chromosomes here. So just the divisions during sexual production. Next question we have during human ontogenesis or human development. There is a physiological bond between the mother and the fetus. So this is of course what is the link between the mother and the fetus, how the mother can give food to the fetus and so on through the placenta, right, through the placenta. Next question, other options, for example, yolk sac will produce, it will be a hematopoietic organ or hematopoiesis, it will produce red blood cells for the fetus. Another Krok question. Here we see data collected by World Health Organization that there are malaria cases, and then they ask in the end about the spread of this disease through what, like which mosquito bite can spread malaria. Anopheles mosquito bite contains the plasmodium, which causes malaria, plasmodium protozoa. Okay. Here we see a hunter drinking raw water from a pond, then he risks infection. So here they ask what helminth we can get from drinking raw water, okay, or water that is not very clean. So fasciola hepatica or fasciolasis, it's from the water, okay, from the water. It's called liver fluke as well. Other questions, liver fluke. Opisthrochiasis, it will have, I think, operculum. It has like this structure. Operculum at its, they will mention in the question, operculum. Opisthrochiasis, operculum. Paragoniasis, it is the helminth that is we get, or the person can get from seafood. Okay, seafood or crabs, eating crayfish. All of these can get, this is called lung fluke as well. Paragoniasis. Yes. Patient complains of urine excretion that occurs during sexual intercourse. What organ is affected? So this person during sexual intercourse has urine that comes out. So this is a problem with the prostate. So you know that after the urinary bladder, this is the urinary bladder, we have here the urethra, right? Around the urethra, there is the prostate. So during sexual intercourse, the prostate presses on the urethra and there is some urine that can go out, so prostate. Here we have during facial trauma, injury to the head, the person developed buccal hematoma. Buccal hematoma. So first of all, they ask what salivary gland is blocked by the hematoma. So they ask about a salivary gland outflow blocked by the hematoma. So first of all, what is buccal? What is hematoma? Buccal means cheek area. Okay, so here. Hematoma means collection of blood. So here we have collection of blood in a cavity, in a closed space. So in this here, the location of the parotid salivary gland, this here. So hematoma happened here. This gland called parotid cannot release its secretions into the oral cavity. Okay, so it will be blocked, parotid, because of the buccal hematoma. Here we see a woman complains of painful chewing when she moves her lower jaw backwards. So she has a problem with moving her jaw backwards. Okay, so her jaw backwards. She cannot move that. So this is responsible for that is a muscle called temporal muscle, chewing muscle, and specifically the posterior bundles. The posterior bundles of this muscle pull the jaw backwards. Okay, pull the jaw backwards. Anterior bundle will pull the jaw upwards. Medial pterygoid muscles, all of these are chewing muscles for mastication. Medial pterygoid will pull the jaw medially, like to the middle, lateral to the lateral, and masseter will pull the jaw downward, I think. Okay. Here, see a similar question. Patient complains of painful chewing when his lower jaw moves forward and to the side. So when he moves, this is anterior view. This is anterior view. When he moves his jaw to the side, okay, he has painful chewing. So moving to the jaw with the side or to the side, lateral muscle, lateral pterygoid muscle. Here we see the person has increased pain sensitivity of the ear skin and ear canal, and palpation behind the sternocleidomastoid muscle was painful. So he has pain sensitivity increase. He has pain around his ear. Okay, it's due to irritation of which nerve? Okay, so even if you don't know what are these nerves and what are from which branch they are, so you know around the ear, auricle. Okay, so if you know in Latin that ear is auricle, then it's nervus auricularis magnus. It's around the ear area. Okay, simply, without too much details. This person has a trauma. Okay, trauma. The patient has dilated pupils. Okay, so the pupil of the eye are dilated like this instead of normal like this maybe. So why they are dilated like this? Because which muscle is blocked? The muscle that will constrict the pupil. Okay, so the sphincter pupillae, the muscle that does this function is called sphincter pupillae. It's not working, so the pupil will just dilate always. Sphincter pupillae. We have cells that alveolar cells, so in the alveoli of the lung, okay, that compose the blood-air barrier, the barrier between the air, okay, or the alveoli and the blood, which takes the oxygen from the alveoli. So what is in this border? The respiratory, alveolar respiratory epithelial cells, these cells that are in the border here that carry the exchange, also called alveolocytes type 1 or pneumocytes type 1, carry out gas exchange. The alveolocytes type 2 or secretory type, they secrete surfactant, very important. Next we have, during experiment, the myotome is destroyed in the fetus of the rabbit. This will cause a malformation of the following structure. So myotome, myo means muscle, and in embryology, the myotome, okay, will form for me skeletal muscles, okay. Axial skeleton, they mean bones by mesoderm. mesoderm layer, dermal connective tissue by mesoderm, dermis of the skin, smooth muscle by mesenchyme, also a branch of the mesoderm. All of these things are the embryological derivatives. Here we see a long question about the kidney histology, okay, and they want cells that provide reabsorption of water, okay, the cells that do reabsorption of water. So the cells that will do reabsorption of water from the urine into the blood, what are they? So if we take the histology of the nephron, the structure that will filter blood, right? It's in the kidney. This is the kidney, and a part of it is called the nephron. The nephron, it's the structure that will filter the blood and make out of it urine, right? So what part of the nephron? This nephron has multiple parts: proximal tubules, this part here; distal tubules, this part here; ascending loop finley, descending loop finley, these parts here. But the collecting tubule, this here, okay, it's the last part. It reabsorbs water. It takes out your water from the urine to the blood vessel, like here. Okay, it takes out water from here to here. So this is a function collecting tubules. Gastroscopy of the patient revealed lack of mucus in the coating of the mucous membrane. So this is called by dysfunction of the cells of which cells? So lack of mucus, which cells produce mucus? Either GIT or respiratory tract. Cells of the prismatic glandular epithelium. So first of all, the cells that produce mucus, they are goblet cells. Okay, but in the stomach, these cells in general, they are columnar in shape. Columnar in shape. Okay, so columnar in shape, another name for columnar, prismatic. Prismatic means columnar in shape. So they call them in the cells of the stomach, cells of prismatic glandular epithelium. Parietal cells will secrete acid. Main exocrinocytes, also called chief cells, will secrete for me pepsinogen, enzyme for digestion of proteins. Cervical cells also has some role in regeneration, I think. Endocrinocytes also has a role in activating the G cells. So prismatic glandular epithelium. Here we have a question about at the cemento-enamel junction. At the cemento-enamel junction, there are non-calcified areas through which infection often penetrates in the tooth, name these structures. So, between the enamel and the dentin, there is a junction here, okay? And there are some holes, okay? Some holes, let's say, that the infection can spread to from the enamel to the dentin. Okay, so what are these openings called? Enamel tufts. Memorization. So this openings between the dentin and enamel, the infection can go from the enamel and dentin. Here we see an ovary has a structure with glandular cells that contain lipid droplets. So in the ovary of the woman, okay, we have inside it cells that contain lipid. So lipid equals fat, okay, equals cholesterol, or some type of fat is cholesterol. Cholesterol makes steroid hormones, such as progesterone. Progesterone is a steroid hormone, just meaning that it comes from fat. So this structure they are referring to, it's the corpus luteum. Corpus luteum, it's the yellow body, and it's very important in the pregnancy, okay, in the early pregnancy, in the all of this menstrual cycle, okay, and it produces progesterone, which is what? Lipid in nature, lipid in biochemistry. It's from cholesterol. So lipid droplets, corpus luteum. Here we see in the heart cells with central position of the nucleus and some myofibrils and connected by intercalated disc. and they are responsible for which function. So this is the classical description of the cardiomyocytes, or the cells that carry out the contraction in the heart. They have between them intercalated discs. Okay, these connections called intercalated discs, specific for the heart muscle cells, cells of heart contraction. Here we see after inhalation of dust, a person develops cough. Okay, so we have in our lungs irritant receptors that whenever dust, okay, they will the person will cough. We see here electric current affected muscle fiber, resulting in depolarization of the membrane. Depolarization developed the following ions penetrating the membrane. So in action potential, okay, we have here the depolarization, repolarization. This is depolarization, and it depends on sodium ions, depolarization. Repolarization, it's the cell resting, it depends on potassium ions. So here, depolarization, sodium ions. Here we see a dog received a weak solution of hydrochloric acid through a tube inserted into the duodenum. Primarily, it will result in increased secretion of the following hormone. So here, they ask about a hormone or a substance that is secreted in the duodenum. Okay, so here we have what? We have the stomach, and after the stomach we have the duodenum. So hormones produced in the duodenum are two, okay, secretin or cholecystokinin. Okay, hormones produced in the stomach are gastrin, okay, and that's it. So here the answer can be either secretin or cholecystokinin. Histamine activates gastrin, activate parietal cells. So it's not a hormone here. Gastrin is in the stomach, not in the duodenum, so it can be the answer. So we have secretin or cholecystokinin. So here the function itself, that secretin response is the response to the hydrochloric acid in the duodenum. So whenever we have HCl in the duodenum, whenever we have that, okay, the response to that, okay, will be secretin by the duodenum. Okay, why? Because secretin produced here from the duodenum will tell the stomach, please decrease hydrochloric acid, because the duodenum is not designed to tolerate acid. Okay, only the stomach should have acid. So whenever there is acid in the duodenum, the defense mechanism for the duodenum will be to secrete secretin and tell the stomach to decrease its acid. Cholecystokinin function will be to increase pancreas secretions. Okay, stimulate the pancreas and stimulate the bile production. So to digest fat by the bile, and to digest fat as well by the pancreas enzymes and other fats and carbohydrates. Here we see a woman with edemas, and in her urine a large amount of proteins. Okay, so she's losing proteins in her urine. So again, about the nephron, if the filter, okay, here there is something wrong with the filter here, called the glomerular filtration, then I will have proteins in the urine, because normally I have minimal proteins in the urine. But in case they increased, okay, they increase a large amount, it means there is something wrong with the filter. What is this structure here with the blood vessel, with the filter? We call it the renal corpuscle. All of it's with the glomerular filtration barrier plus the blood vessel. Here we see someone suffering from diabetes and has fasting hyperglycemia 7.2. What we should use to assess his glycemia or blood glucose levels for 8 weeks prior to the examination. So if he comes to the clinic, how do we know his glucose levels 2 months before the clinic, we measure his glycated hemoglobin, because hemoglobin and red blood cells stay in the blood for 120 days. So they, and if in glucose increase in the blood, the glucose will bind to this hemoglobin, produce for me what's called glycated hemoglobin, and this hemoglobin will stay in the blood for a long time. So it can be used for like assessing glucose levels in that period. Here we see someone exhausted by starvation. He does not eat well, okay, for a long time. So if someone does not eat, then he has low glucose. Okay, so which process will be activated in his kidney, liver and kidneys? So from where will he bring glucose? He will break down his proteins. He will use his amino acids to produce glucose, and this is what we call gluconeogenesis, producing new glucose from other sources in case of starvation. Mucin, like mucus, okay, in our mucous nasal cavity, GIT, it retains water, it stores water, and mucin is viscous, it's like thick. Why it's thick? So mucin, as a biochemistry, has in its structure glycose aminoglycans, and it's in its structure that gives it this viscosity. Here we see a diabetes mellitus patient developed unconsciousness and convulsions after administration of insulin. What will be the blood glucose result analysis in this case? So, insulin decreases blood glucose, right? Decreases blood glucose. So after this person took insulin, the blood glucose decreased a lot and he felt unconscious. So the blood glucose level should be decreased, okay? So how you should know the normal blood glucose in the level in the blood, 3.3 till 6 millimoles per liter, okay? So all of these are more than 3.3, more than 3.3. So they are not hypoglycemia or low blood glucose. Only one can be the answer. Here, chronic overdose of glucocorticoids leads to hyperglycemia. What process of carbohydrate is responsible for this effect? So glucocorticoids are drugs, okay, that can activate the process of new glucose formation. As we said, it's gluconeogenesis, and this will lead to the high glucose levels in the blood. It's just a hormone, okay, can use as a drug, can activate this process. A patient with glossitis, inflammation of the tongue, has disappearance of the papillae on the tongue, has burning pain in the tongue, and erythrocytes are 2.2, hemoglobin 103, color index 1.4. What type of anemia is it? So first of all, this is, he has inflammation of the tongue, disappearance of lingual papillae, so shiny tongue, classical feature of B12 deficiency. First of all, he has anemia because erythrocytes are decreased, 2.2, normal is 4 to 5, color index is 1.4. This is very important, color index. Color index, guys, normally it's 0.8 till 1. Okay, more than 1, it is a high color index. We see it where in B12 or B9 deficiency anemia. Okay, B12 or B9. So B12, folate, B9 deficiency anemia. And also one of the characters of the B12 deficiency anemia is shiny tongue. Shiny tongue. Iron deficiency anemia, okay, they will tell you about color index less than 0.8. Less than 0.8. Low color index. Thalassemia, they will tell you target cells, keyword. And plus iron deficiency, they will tell you about nail problems, hair loss, and so on. A pregnant woman developed severe toxemia, exhausting, vomiting. Okay, so she has a lot of vomiting, and she developed dehydration at the end, acid-base imbalance. So guys, for these questions, each condition, you should understand it, why it happens. So in vomiting, we have in our stomach, as we said, hydrochloric acid. And when vomiting happens, we lose this acid. We lose this acid. Acid will decrease. So what will stay inside the body? less acid, the opposite of acid is alkaline. So we will have alkalosis. So all the acid answers you should exclude. What about is it gaseous, is it non-gaseous? So here the problem is because of vomiting. So it's not because of any gases, not because of respiratory or something with a respiration. So it's non-gaseous excretory because of losing hydrochloric acid. Here we see a girl at the hematologic department. She was diagnosed with iron deficiency anemia. So what type of hypoxia does this patient have? So as we said, anemia in general, okay, any anemia, iron deficiency or B12 or B9 or any anemia, okay, it will decrease oxygen carrying capacity, because the primary problem with anemia is that there is less cars for the oxygen to go in. Okay, so who will carry this oxygen? Nobody. And we will have hypoxia, low oxygen supplying to the tissues. And we have types of hypoxia. Okay, if it's due to hemoglobin or red blood cell problem, we call it hemic. If it's due to blood circulation problem, circulatory. If it's due to inability to use this oxygen, for example, poisoning by cyanide, so this will decrease the ability for the cells to take oxygen and use it by inhibiting in the mitochondria the process of oxidative phosphorylation. Respiratory, maybe we don't take this oxygen, there is something wrong with the lung, bronchial asthma, pneumonia. Can be mixed causes. Here this person has acute glomerulonephritis, inflammation of the glomeruli we spoke about today, okay, and this inflammation caused anemia, okay. Why anemia happened in this case? So you should know that one of the functions of the kidney other than filtering blood is producing something called erythropoietin. Erythropoietin stimulates the bone marrow, okay, where we have red blood cells production. So if something wrong with the kidney, for example, inflammation of the kidney failure, erythropoietin will decrease and nobody will stimulate the bone marrow to produce for me red blood cells. So I will have anemia. And this is because decreased erythropoietin synthesis. Here a man, he has a long time suffering from osteomyelitis, okay, inflammation of the bone. But here the keyword is for a long time. And then he died of chronic kidney disease and there are lardaceous kidneys. So this is a classical description of renal amyloidosis. A long time he has some disease, okay, and this disease will trigger the release of amyloid protein, which will deposit in the kidney and cause renal amyloidosis. And the key words here, long time, lardaceous kidney, waxy kidney, greasy kidney, shiny kidney, all of these, the appearance of amyloidosis in the kidney. Here we see in the lung tissue areas of high airness, okay, with bubbles. And we have thinning and rupture of the alveolar septum and with a lot formation of large cavities. What disease is it? So this disease is called emphysema. Emphysema, instead of this alveoli having having this structure, okay, loss of elasticity in the alveoli will make it look like a big cavity, okay. So loss of the septa or the border between each individual alveoli, each individual alveolar sac. So the loss of the septa will, thinning and rupture of the septa will cause this large alveoli, and it will store air. It will be inefficient in carrying respiratory functions. This is pulmonary emphysema. Another key word that will present with crunch sound in autopsy. And of course, you should know that it's due to decrease of alpha-1 antitrypsin. It's the molecule that will protect the alveoli from going to this condition. Here we have a woman suffering for a long time from hypertension, increase of the blood pressure, and she had her kidneys diminished in size. So what is the cause of this? So guys, this is atrophy, but which type of atrophy? Hypertension, okay, high blood pressure. This blood pressure, high blood pressure, will prevent the kidney from getting enough blood. Okay, so the kidney will not get enough blood, it will shrink in size. So it's due to inadequate blood supply. Here, a man used a poisoning substance, and then he has his kidneys damaged. Okay, they have medullary substance is dark red, so it's closer to dark red, and they will enter then black color. So when you see this poisoning then caused dark red or maybe caused necrosis, it means it's necrosis in the nephron of the kidney. This poisoning substance did not only cause inflammation but also destroy the kidney. Microscopy infection diagnostic is insufficient information due to morphological similarity between many species of microorganisms. So they say that microscope may be not enough to do diagnosis because a lot of microorganisms are similar. For example, a lot of them are gram-negative bacilli. They all look the same. What immunoassay or what test we will use to increase the informativity of this method? So if we want to look at the bacteria better way, we can use fluorescent immunoassay. It will separate the bacteria based on antigens. It will give a better view. Combs test, immune enzyme test, radioimmunoassay, these are all for the antibodies, the molecules that are against the bacteria, but for the bacteria itself, fluorescent immunoassay. Even though fluorescent immunoassay, we can use it as well for the antibodies, but here it's the answer. So sometimes the answer can't be very accurate. Drug used for specific treatment for diphtheria. Specific treatment of diphtheria, antitoxic serum. Okay, so diphtheria releases toxin, so we give the patient antitoxin serum. Anatoxin will be for vaccination against diphtheria. Vaccination, not a treatment, prevention. Okay. If someone has gonococcal conjunctivitis in a child with signs of suppurative keratoconjunctivitis, what laboratory diagnostic should be conducted to confirm the diagnosis? So gonococci is a gram-negative diplococci. So it looks like this. Diplococci means like that the two bacteria are like closer to each other in this coffee shaped or something, and it causes conjunctivitis. The best way to diagnose gonococci is to look at under microscopy. Why? And also bacteriological analysis. Microscopy because few bacteria look like gram-negative diplococci, and we can visualize it better. Not, for example, like E. coli or Salmonella or Shigella, they all look the same, so we cannot diagnose E. coli only in microscope. But gonorrhea looks, only one bacteria is gram-negative diplococci. Okay, two bacteria, gonorrhea and Neisseria. But if someone presents with symptoms of gonorrhea and we see gonorrhea in the microscope as this, then it's only gonorrhea, not anything else. Okay. Bacteriological analysis means just we take this bacteria, we make it in culture medium, so this also can work for gonococci. Here we have gram-positive diplococci. So as we have only gram-negative diplococci, we have only one gram-positive diplococci, only one. So this is a Streptococcus pneumonia, and it causes pneumonia. Streptococcus pneumonia. Gram-positive diplococci. Neisseria meningitis and Neisseria gonorrhea, they are both gram-negative diplococci. But they cause different things. Meningitis, it will cause meningitis. Gonorrhea, it will cause sexual transmitted disease like urethritis, and sometimes in newborns, conjunctivitis. Here we want to determine community members' immunity against diphtheria, and we verify the need for their vaccination. So we need to check their immunity against diphtheria. What investigation is necessary? So we see in their blood their antitoxin levels. Okay, so we see in their blood they have a lot of antitoxin. It means that they have already the defense, okay, is ready against diphtheria in case it invades the body. Okay, so if they have titer or level of antitoxins increased, no need for vaccination, no need for it. Okay, antibody titer, it's not correct, because diphtheria forms against it. It forms toxin, and what should form against it? Antitoxins. So diphtheria attacks by toxin, we should need antitoxin against it. So if it's present antitoxin in the body, no need for vaccination. If it's not present, we give vaccination. This woman has taken mixture for neurasthenia. So she has this neurological problem, fatigue, prescribed by a neurologist. Her general state improved, but surely complained of rhinitis, inflammation of the tongue, inflammation of the nose, conjunctivitis, fatigue, memory impairment. So these rhinitis, conjunctivitis, runny nose, in other questions, tears from the conjunctivitis or tears from the eye, it all means that she had taken bromine salt or sodium bromide. This is a drug, okay, and they always ask the same question, that it's a sedative drug, first of all, sedative drug. And its side effects are classical rhinitis and conjunctivitis. Oral thrush is candidiasis, okay, fungal infection of the tongue, and we use for it nystatin, antifungal. Someone has prescribed a psychosedative for the fear of pain. What drug would be the most effective in this case? So fear of pain, anxiety, okay, we should give anxiolytic diazepam, okay, or in the case of insomnia, inability to sleep, we give something that act as a hypnotic. So it decreases anxiety, used in case of pain, fear of pain, sorry. Here we have a patient with skin burns was delivered to a hospital to clean the wound from necrotic tissues. The doctor prescribed an enzymatic drug for topical treatment, name this drug. So here we want to clean the wound from necrotic tissues, okay? So necrotic tissues, we need to lysis this necrotic tissue. Lysis. Necrotic tissue has a lot of proteins, okay? So we need to do proteolysis. So we should use a proteinase, trypsin. It breaks down proteins. Someone suffering from ciliary arrhythmia with a history of bronchial asthma should be prescribed an antiarrhythmic drug. What antiarrhythmic drug is contraindicated in this case? Okay, so this is some pharmacology. First of all, what is ciliary arrhythmia? It's arrhythmia originating in the SA node. Okay, so what is SA node? Sinoatrial node. It's the pacemaker of the heart. So it defines, it gives impulses to the heart, tells the heart contract now. Okay, and it makes this as a rate of 60 to 100 beats per minute. So in arrhythmia, it's the disease, okay, that will be, if it's here ciliary arrhythmia, we'll have more than 100 increase heart rate, okay, depending on type of arrhythmia. So here they don't ask about this. And you should know also that SA node controls it beta 1 receptor, okay. So here we have beta 1 receptor on top of the SA node. Beta 1 receptor, how do you memorize beta 1? 1 heart, okay. Beta 2, 2 lungs. Anyway, what activates beta 1? Sympathetic system through epinephrine, right? So if we have epinephrine here increase, beta 1 will be activated, and we have high heart rate. So here, to treat the ciliary arrhythmia, to treat it, we can give beta 1 blocker. Okay, beta 1 blocker. It will block the beta 1, decrease the heart rate, right, and treat the arrhythmia. We can use beta 1 blocker like metoprolol and anaprylene or propranolol. But propranolol does not, metoprolol only inhibits beta 1. Propranolol inhibits beta 1 and beta 2. Okay, how to memorize this? 2 P's. Propranolol, metoprolol 1P. So beta 1 inhibits beta 1. So, okay, we can use either this drug or this to treat the arrhythmia. But what is the problem? Is that if someone has, for example, arrhythmia, okay, and I blocked for him his beta 1, okay, I solved the arrhythmia. I give him propranolol, okay, propranolol. I give him beta 1, it solved the arrhythmia, very good. But it also inhibits beta 2. Beta 2, as we said, it's present in the bronchial walls, in the lungs. Okay, beta 2. Okay, if I block beta 2 normally, what it does? It dilates the bronchi, makes them wider. I can bring more oxygen. So if I inhibit beta 2 here, what will happen? The bronchi will constrict. They will become narrower. Okay, in someone who has already narrow bronchi, in case of someone with bronchial asthma, I will cause him even more narrower bronchi and even will make him enter attack of asthma. So of course I can solve for him arrhythmia, but I can give him bronchial asthma. So I should not use propranolol in case someone has bronchial asthma. It's contraindicated, not recommended to use it. So only use metoprolol. A newborn failed to take his first breath. Autopsy revealed that despite unobstructed airways, the lungs of the newborn unable to stretch. What is the most likely cause of this condition? So this newborn, there is no obstruction in his airway, but he cannot take his first breath. So it's because there is something called surfactant, okay, that enlarges the alveoli, makes the alveoli increase. So without the surfactant, we will have collapse of the alveoli. They will be very small and they will not be enlarged. So look here out for the newborn. He cannot breathe. Okay, it's absence of surfactant. Usually it's a preterm baby or something. Here we see a classical question about diphtheria, about dystrophy, sorry, and we see yellow areas in the endocardium. So it means yellowish areas, there is fat in the endocardium, fatty dystrophy, fatty degeneration. Here we see the parotid gland. There is a damage to the cells with secretory segment. What cells are these? So you know all salivary glands has a secretory part and a duct that will deliver its secretions. This secretory part, okay, is composed out of cells. Maybe these cells are serous cells, maybe they are mucous cells, but the parotid gland has serous cells because they secrete more serous secretion, more watery, while submandibular and sublingual produce more mucus. And plus the serous cells, okay, the parotid gland has myoepithelial cells. These are cells that will contract, they are they have muscle, contract to push these secretions to the duct. So serous cells, myoepithelial cells, the parotid gland. Here we see a child with signs of rickets has been prescribed a vitamin. Okay, so rickets means softening of the bones in children. Okay, softening and weakening of the bones, and it's probably due to decrease of vitamin D. Okay, and they prescribe the vitamin. They describe this vitamin. Why this vitamin will work here? Because it can increase calcium, okay, and calcium will make the bone stronger again and will prevent the rickets. So that's the increase the calcium is by vitamin D. Vitamin D decrease, I have rickets. Vitamin D increase, I have good calcium, good bones, and so on. And vitamin D, another name is called ergocalciferol or calciferol. So I hope this is the first 50 questions. I hope it was useful. And please don't forget to like, subscribe if you like these types of videos.